Yes, hello, good evening. How are you doing? Welcome to another session of Ask the Doctors. It's Sunday, the time is 8 p.m. here in Nigeria. How are you? Happy Sunday to you. My name is Dr. Frederick Unwibohai. I'm the host of the program, and this program holds every Sunday from 8 p.m. to 9 p.m. West African time. On this program, today we'll be taking questions and answer. If you have any question for us, drop it in the comment section and we'll try our best to respond to you. But remember, no prescription, no diagnosis. We can't do that on social media. But if you know you have any questions for me tonight, you can drop it in the comment section and I will try my best to respond. My co-host is going to be here very soon, Dr. Israel, and together we will be responding to your question. So if you have any question for me, drop it in the comment section. We are live on YouTube and we are also live on Facebook. Yes, yes. So tell me, yes. So I can see you. Yes, you are. You are here. Okay. Yes, we have comments here. Let me see. Good evening. Who is here? Faith. Faith Stanley. Good evening. Happy Sunday. Roots Ademola, happy Sunday to you. Yes, good evening. Wise Mice Maureen. Maureen, how far now? How are you? Abednego, watching from Asaba. Oh yeah, tell me, where are you watching me from? People plenty today. Oh. Hey, Cynthia. Cynthia, good evening. How are you? Funke. Funke, I see you too. Good evening. So if you have any question for me today, please drop the question in the comment section and we will try to respond to you. But don't forget, share this video. Some people are watching me on YouTube. If you dey watch me for YouTube, oh yeah, drop comment. Yeah, I can see you. My YouTube people are here. Funke is watching me. No, Funke is on Facebook. IG, IG Best is on YouTube. I see you, IG. Who is this again? Stella. Stella is watching us on YouTube. Okay, let me see. Good evening, Doc. Watching from where? Watching from Chokocho Eche, River State. This is the first time I'm hearing that word. Okay. Una plenty, oh. Wetin dey happen? Oh yeah, ask me. Let's go, let's go, let's go. Chibuzo, I greet you specially. Omo, see people, oh. Wetin dey happen? Oh yeah, ask me the question. No time. Mohammed, I greet you specially. Mr. Philip is here. Mr. Philip, I see you. I see you. Yes, I'm always here. I know. God sent Abuchi. Hello, how are you, ma? Okay, now today we are going to take some questions. It's an open day. Open day. So any question you have for me or Dr. Israel, you can drop it in the comment section and we will try. But I beg, we no fit treat you online. Hmm? Don't come and ask me, doctor, uh, when I go toilet, this and this one, they pain me and this, what medicine? No, no, I can't diagnose you online. But if there is something you want us to clarify or explain, or you can ask me and I will try. Uh, you are doing well. You are doing well. What can someone use for immune boosting? Mr. John Akobundu. Number one, if you want to boost your immune system, number one, your lifestyle is important. Your lifestyle. You don't need to look for anything to use. Yes, there are some things you can take. But before you take anything to boost your immune system, your lifestyle is very important. Your feeding is important. Wetin you dey chop? If you dey drink alcohol, you dey smoke, igbo and the rest, you are nothing go take wey go work for you. You need to sleep. You need to avoid stress. You need to do all these ones first. And after you don do all these ones, then we can now tell you, okay, add this supplement or this supplement. Shey you understand? But the first thing to do is sleep, eat well, balance diet, eat fruits, exercise, avoid alcohol, avoid smoking, cut down on your body weight before you can now do what? Think of taking any supplement, anything to drink. Is that okay? Ehen. Oya o, share the question. Dr. Israel is here. Let me bring up Dr. Israel. Dr. Israel don come. No time. What we do am? Dr. Israel, good evening. How you dey? Dr. Israel, you dey hear me? Hello?
Hello, Dr. Fred. Happy Sunday.
Yeah. Happy Sunday. How you dey now?
Fine though.
Yeah. Okay. So, I don't start to dey take questions sharply, sharply. Now we have a comment here. I don't start. The person says, who be this? Mr. Oriade Crown. What's the best way to treat syphilis? What is the best way to treat syphilis? My guy, the best way to treat syphilis is tied to the type of syphilis where you get. There are different types of syphilis. There are different types. But to treat syphilis is at the hospital. And most times, na antibiotics that they use treat syphilis. But syphilis get different types. We get the secondary one, we get the congenital syphilis and primary one. So depending on the type of syphilis where you get, they go come use antibiotics. They might use tablets or they might use injection. Is that okay? Okay, Dr. Israel network dey show am shege. Um, Dr. Israel, are you back?
Yeah, I'm back.
Okay, you're welcome. So let's start. But your network dey seize. Patricia, which Patricia is this? Patricia, good evening. Happy Sunday. Doctor, can AS donate blood to AS? Yes, AS can donate blood. However, if you want to donate blood, we use your blood group. Now blood group we dey always check. So if you are A positive, A negative, B positive, B negative, O positive, O negative, we go need to pay attention to that one. So we need to know your blood group. But also, or in addition, AS can also donate blood to another AS. Yeah, sure. Oh yeah, share this live session. Share. Mr. John, I see you. Um, Stella. Stella says, please, does a woman ovulate every month? This is a very good question. This is a very good question. Not all women go ovulate every month. Not all women. Some women go see their period, but because say dem get one problem or the other, they might not ovulate that month. So a woman can actually ovulate every month, but not all women will ovulate every month. Some fit get ovary problem, some fit get ovarian problem, some fit get hormonal issues. All these things can affect ovulation. But if you are fine as a woman, you no get any problem, yes, you can ovulate every month. It's also tied to the length of your menstrual cycle. So if your menstrual cycle is about 28 or even 30, 28 thereabouts, you can ovulate every month. But if your menstrual cycle is like 35, your ovulation might not be every month. So there are many things to check inside it. I hope I tried to explain them to you. Oh yeah, share. If you know you are learning something, you are gaining, like, subscribe if you haven't subscribed, and then share. This question says, Doctor, abeg, wetin dey make man no dey last during mekwe? Just 2 to 5 seconds during intercourse. Abeg, e dey normal? No, e no dey normal. Wetin be your name? Mr. Sonny. It's not normal for a man to mekwe 5 seconds. Actually, the normal time is about 7 to 13 or 14 minutes. So if a man dey release too early, something dey cause am. Number one, maybe this man, the man body dey shake well well. E get some men, the moment dem sick kpekus like this, they don release, the body dey shake. The moment the man put blockers inside kpekus, I'm using this word deliberately, abeg, the man don release. E get some men, dem get problem sef. Sometimes dem fit get anxiety problem. That one, dem go need the help o. E get some men, dem dey drink medicine, dem dey always take medicine. Dem dey always take medicine to make well. Now, dis men, if dem wan make well, dem go fit also get problem. So we need to find out when dis thing start. Wetin and wetin be your lifestyle? You dey take alcohol, you dey smoke, you dey take medicines, then we'll come know wetin to tell you. Sometimes you might not need any form of medicine. Sometimes you might need medicine. So e no dey normal for a man to release in within 5 seconds. Na very bad thing. But solution dey. The solution na for hospital, no be medicine, no be coco samba, no be that one. Yeah. Okay. Now, doctor, what is the cause of BP? Wetin be your name? Your name is Chinedum. We spoke about this last week. Abeg, go and watch the video. Please go and watch the video. Last week, we spoke about high blood pressure. Nothing like BP. BP is not a disease. Every human being get BP. That is blood pressure. So if you tell me, say, doctor, I get BP, I go vex for you. Because BP is not the problem. High BP, that is high blood pressure, or low BP, low blood pressure. So don't ask me and say, doctor, abeg, I get BP. No. I have high blood pressure. Wetin dey cause am? Plenty things dey cause am. We explain am last week. Wetin be the solution? Sometimes you no go need medicine at all. Just change your lifestyle. E go help you. Sometimes you might need medicine. E big well. So go to my page, go to YouTube, watch the video. E dey long o. Every answer wey you dey find, e dey there. But don't ask, I have BP. No. Every human being get BP. The person wey no get BP na person wey don kpai. As long as you are living, you have blood pressure, and your blood pressure should be normal. But when e come go high, then na there problem dey. Do you understand? Okay. This question, oh yeah, before I take this question, everybody share the live session quickly. If you are watching me on YouTube, like, share, subscribe. Oh yeah, let's go share. If you no share, you know they support me. Oh yeah, let's go. Now only 6 people now don't share this live session. Like, why? Hello, sir. Why? What's going on? Like, what's going on? Share. Oh yeah, share. Share. Oh, if you now no share, I go start to dey talk about football. I will start to talk about money. Share. Give me, I give you. Oh yeah, I'm waiting. Like, damn, only 8 people don't share. Like, why? You guys should share. People are not sharing. Like, I don't understand what's going on. I really don't understand. So I need you to share, and then we can continue. Okay. This person says, please, sir, I will be due by August and my baby is fine, but my tummy is not as big as that of my first son. Is it possible for my pregnancy? Is it possible for my first pregnancy to grow bigger than my second? You'll be due by August. This is what? May, June, July, August. Okay. Now, Maureen, every pregnancy, whenever woman get belly, every pregnancy is different from the previous one. So if you don't get belly 5 times, those 5 different pregnancies not be the same. The first pregnancy, you might fall sick. The second one, you might not fall sick. The third one, you might be eating, belle fit big. The next one, belle no go big like that. So every pregnancy is unique and different. Having said that, if you feel say the belle no big like the previous one, when you go for your antenatal, when you go antenatal, tell them they go check your belle, they go check the pikin, they go look whether everything dey okay, whether the pikin dey grow well for belle. And if the pikin dey grow well for belle, they go tell you say, madam, don't panic, don't be scared. But if something happen, maybe you know they chop well, or you know they take your medicine, or one thing or the other, they go also tell you. So the only way to be sure is when you go for your antenatal, they go do your scan, they go examine your belle, check, and they go tell you. And if they tell you say you are okay, oh baby, no panic, you are what? You are fine. Now, people are sharing their question. Yes, I can see you are sharing. You are sharing. I dey do first come first serve. I dey try check the questions. Let me see. I dey try check the questions. Oh my god. Uh okay. Somebody says, Cynthia, what can be the cause of lower back pain and also pain around the right side of the abdomen? So I'm going to take the lower back pain. Lower back pain can be caused by plenty things, plenty. Whether you be man, woman, you old, you young, anybody fit get back pain. But commonly, back pain dey affect elderly people, papa and mama wey don old. Back pain dey affect young people wey dey carry heavy load, dem dey sit down for too long, back pain dey do dem. But old people, na age. After you don old, you don use your back, you don waka well, the back can pain you small. That is it. Now, okay, Dr. Israel is here. Now, Dr. Israel is back. Now, back pain can also be caused by other problems. Even your body weight can give you back pain. If you go fat, e get how you go fat, e go affect you for back. E get how you go fall, you go fit give yourself back pain. E get how you fit get sickness for some other part of your body and it can affect the back. So back pain can be caused by so many things. And then if you can't notice, say as you get back pain, when you move, when you walk, you no dey fit waka well. Your leg dey hook you, your leg dey shock you. You no fit bend, all the pain dey tight well. Abeg, you go need to run to hospital. But if the back pain just start 2 days ago, no too panic. Take medicine for pain, rest, maybe e go disappear. Dr. Israel, wetin dey happen to your network today? Dr. Israel, wetin dey happen to your network today? Oh, can you hear me? Wait, I can't seem to hear Dr. Israel. Why? What's going on? Okay, let me see if I have a question here. Uh, my God. Una questions plenty, Una questions plenty, and wetin dey happen? Wetin dey happen? I'm trying to see how I can do this, but the questions are just so many. Wait, let me see. Where is this? Where is this thing? This thing no dey scroll down. Okay. God, abeg oh. You get one question. I'm sorry, I don't miss your question. I know if it okay. What is the cause of your menstrual cycle changing every month? What do you mean by changing every month? Evelyn, what do you mean by your menstrual cycle they change every month? Because if you see your period on the first of the month, your period will not come every time on the first. Your period will change. Sometimes on it can come on the 5th, it can come on the 7th. Your period will not come every time, that same date, every time. No. Because your body too, as a human being, um, your body goes through different forms of stress. So that stress will make your period this month, your cycle might be 28. Next month, it might be 26. Next other month, it might be 30. But as long as your cycle is still within the normal, then they within that same normal. You don't need to fear. But your period will not come every time on that same month. Ah, doctor, and January, I see my period 10. February, I see my period 6th. March, I saw my period 14. Please, oh, I don't understand. Stop it. Your period will not come on the same date every month. Okay. If you know so you never share. If you know say you never share, please share now. Now, share. At the look you share. If you never subscribe, yeah, invite your friends. Let's go. Let's go. Let's go. Let's go. Let's go. Share now. Una know the share. That be my problem. Ah, which kind matter be this one? Ah, okay. Oh, can a woman be ovulating but cannot get pregnant? The answer is yes. A woman can ovulate and not get pregnant. Why? Number one, she's not meeting her partner during her fertile window. As a woman, if you dey ovulate but you dey meet your partner at the wrong time, belle no go enter, but you are fine. Sometimes you might be ovulating, maybe your tubes are blocked. Sometimes the woman might be okay, but her partner, the man, na get problem. So when a woman dey find pikin, no be only the woman we dey follow talk, na the woman and the man we dey check. Because African women, they don too blame them. Ah, belle never come, na woman fault. Sometimes e might even be from the man. So don't make it look like as far as I'm ovulating, I must get pregnant. It might just be say maybe na the man, or you know they meet well, or you dey miss, or so many other things. Dr. Israel, can you hear me now?
Yes, I can hear you.
Okay, thank God. We have more questions here. Um, this person they ask us questions where we don't talk about last week. He says, "What is the best way to treat high blood pressure and high sugar level of 197?" Please respond, I beg.
Okay, the best way to treat high blood pressure na to go hospital, go see your doctor. That na the so that he can give you medication. Yeah, those are the medical way. Now, when we want to talk about what you fit do for house, one, you need to reduce the kind of salty diet. You need to reduce salty food. Two, you need to do exercise. You need to change. Three, you need to change your lifestyle. If you dey drink, you need to stop. If you dey smoke, you need to stop. um Four, you need to reduce the number of cholesterol wey you dey take, because that can actually be wetin dey cause am. So that's why you need to go hospital so that make dem do test to know other things wey dey cause am. Den sometimes e fit be say there's family history of high blood pressures. So but if you don fit do all dis other one, den if you are overweight, you need to lose weight as well. You need to lose weight. So if you fit do all dis ones and the blood pressure never still go down well well, then you now need to go hospital make dem give you medication. Couple with all dis exercise and all dis homemade stuff wey you dey do, and the medication wey your doctor go give you for hospital, all of dem go work together and make your blood pressure dey normal. Den for the sugar level, if the blood sugar dey high, na still hospital you need to go. And you also need to see a dietitian. And there is people wey dey wey study things about food when people dey eat. Also, you need to reduce all those food wey contain a lot of sugar. Yeah, all those processed sugar diet, because all those one na go fit quickly make your sugar go up pass your normal your normal diet. So we also say you can eat your normal diet, but you eat it in a little quantity. And if you want eat swallow now, you take a very small swallow wey be like your palm, then you eat a lot of vegetable. If you want eat rice, there's wetin you need to mix am with beans. So there's difference between rice and beans and rice. um Beans and rice mean say the beans many pass the rice, while rice and beans the rice many pass the beans. So e go be more of beans and rice. So the beans should be more than the rice if you must eat rice, and also with a lot of vegetable. So you also need to know the kind of swallow wey you go take. So you need to reduce the ones wey go fit increase your sugar level very well. Den exercise cannot be over emphasize. You also need to do exercise. So exercise is so very important. E cut across almost all medical condition, even physical condition and all that. Exercise cut through all of dem. So you need to also do exercise, and those will help you. Dr. Fred.
Thank you, Dr. Israel, for responding. We have a lot of questions today. God, if you never share now, share now. If you no share, we're gonna go answer you. Now so life be. Do me, I do waiting, I do you. God no go waiting. God no go complete am now. God no go what? God no go vex. My wife can't conceive 7 months now after marriage, and she doesn't know her ovulation. Please help me out.
Okay, your wife cannot conceive 7 months now after marriage. How old is your wife? If your wife is a young lady, it's not a problem. Whenever every woman calls say that one never that one get infertility. Infertility can only be when you dey meet very well for almost a year. Before you can actually look at it as infertility. But that's based on age though. That's based on age. Yeah. So and another question wey we go need to find ourselves now, how una take dey meet? How of ten do you people meet in a week? Say in a week you are supposed to meet at least 3 to 4 times in a week. So if una no dey meet frequently and you no know your ovulation, then it's a big problem. So e go make sense say una go see gynecologist, doctors wey dey specialize in women, so that dem go talk to her. Dem fit even teach her how to know her ovulation. And another way you can know, if you check if you dey follow Dr. Fred has also actually made a very comprehensive video on how people go fit take know their ovulation. So you can carry that video show am to your wife, make your wife read am, make e lis ten to am many times, and with that you will be able to calculate ovulation. And another way is that you can get a app. There are some app now in Google Play Store or iOS that can actually teach you how to know your ovulation. So when you do that, then you also do your investigation, the man himself and the woman, because to become pregnant not be just the woman thing, na both partner. Yeah. So when una two do una investigation and everything dey normal, followed by knowing your ovulation, anything pregnancy fit enter. Thank you. Dr. Fred.
Thank you very much, Dr. Israel. Any question on menstrual cycle? Sorry, Dr. Israel has answered that. Yep. Okay. This person, Wisdom, says, what causes your heart to be beating faster than normal? Dr. Israel, let's respond, please.
So what's the faster than normal? What do you mean when you say faster than normal? First of all, you need to know the heartbeat, and the normal heart rate, which is within 60 to 100. That's the normal heart rate. So if your heart rate is within that period range, it not be more than normal. Also, yeah, some people feel get palpitation. And there are so many things wey fit make your heart beat more than that. Anxiety can cause it, exercise can cause it, even some sickness can some medical conditions can cause it. Yeah. So just to mention a few, all those ones can actually cause it. So you need to know, are you afraid? What are you afraid of? You get any shock, you get any disease condition. If there are any disease condition, you need to see your doctor. If the palpitation, if now you dey hear your heart dey beat, if you over don hear am, go see doctor, make dem check your heart for you and know if there's anything inside the heart wey go dey cause that all the time, or if there's anything within around the organs wey near the heart as well. Okay, Dr. Fred.
Okay, let me see. We have a lot of questions. We have about 30 minutes more. Um, I'm just trying to see. We've answered question on blood pressure. Let me see. Let me see. Let me see. See this question here, doctor. Please, what exactly is the cause of breast lump? And I heard from some people that the lumps grow back after removal. Please, how true is that, and what can I do? So, breast lump, there are different types of breast lump. Breast lump, we have the ones that don't have any issues at all. They will not affect the woman's life. We have some breast lump that can affect the woman's life if you don't check what it is. And there are some breast lump, when you remove them, you have no issues at all. Nothing will grow back. Now, the problem I have with some of you listen to people, they say, I hear, say, who say. No, when you go to the hospital, they will tell you, the lump is there. This lump is benign. It no go affect you. Let's just remove the lump and you are fine. You get some lump. That lump na severe problem. They go need to check the lump. Say, this lump, if we don't do anything about it, it can affect you in the future. They remove it. But telling you that it will grow back and that is why, no, no, no. The thing that can happen to you is that if you don't do anything about the lump, we might not know if na lump will cause you problems in the future. Saying that it will grow back, I don't know who gave you that response. It's not true, because so many ladies have lump and they've attended to them and they are fine. Yeah. Dr. Israel, want to say anything to that?
No,
Okay, let's see. Uh let me see. Oh God, oh my God. What be this? What be this? Questions plenty. Uh oh God. The questions plenty today. Okay, somebody says, Doctor, what is the meaning of an empty bag during delivery where she labored and pushed and an empty bag came out with water mixed with blood and then later delivered one baby through CS? I don't think I understand this question. Dr. Israel, please, do you have an idea what she's talking about?
okay, maybe that person maybe they be the thing say now, maybe now twins is supposed carry. So I
Okay.
think what he's trying to say, we have an empty amniotic sac where the baby did not develop. Eh? Uh, well, maybe they were supposed to have a twin pregnancy, but one did not develop, while one developed, and then that's why he was able to have CS and have a baby. Why the one will not develop, uh, not come out as baby? That was what would have happened. Or maybe there are some other things which which sometimes that not be everything dey 100% clear. So but this simple explanation, I think that's majorly what that would have been.
Okay, we have a question here. Good evening, doctor. Watching from Cameroon. Please, can a breastfeeding mother with hepatitis breastfeed a newborn baby?
He said
Can a breastfeeding mother with hepatitis breastfeed a newborn baby?
he says the breastfeeding mother. If you say, when you say you are breastfeeding mother, it means say you don already dey breastfeed now. Is that not what it meant?
Yeah, as long
So
as
you
you're
know
on
when
medication.
you
Yeah, okay, continue.
so it's very important that even as a breastfeeding, when you give birth to a child, you've you give your baby the drug when you suppose give the baby when after delivering, as somebody that have hepatitis B, or depends on the hepatitis, or I talk about hepatitis B. Yeah. So if you give your baby the breast when you suppose, sorry, immunization wey you suppose give your baby, there's no problem why you cannot breastfeed.
Okay. Okay, we have a lot of comments here, but these people are not sharing. Sir, you are skipping some questions, please. I'm skipping because there are so many and I can't pick them. So keep sending your question, eh? Yeah. Let me see. Let me see. Um, my God, una questions. They. Oh, what's this? How can one? Somebody says, how can one treat heart enlargement?
If you want to treat heart enlargement, you go to the hospital. That's a place to treat heart enlargement.
Treat heart enlargement called cardiomegaly at the hospital. You will see a cardiologist. They will tell you what is causing your heart enlargement and then they will treat it for you at the hospital. After you see a cardiologist, you cannot treat heart enlargement. What's burning? Okay. You cannot treat heart enlargement on Facebook. You cannot treat heart enlargement online. That is how you treat it. So we'll find out what is causing it and then they will now help you. But looking for medicine to treat heart enlargement online is like trying to unalive yourself. Okay, let me see. Questions just full here. Doctor, please, I'm having who be this? I'm having pain at my right side, my right chest of nipple. It seems like something there inside. Is it normal? The left one has stopped and okay. I don't understand. Israel, I beg.
I don't understand. Read the question again.
Somebody says, I'm having pain at my right chest of the nipple. It seems like something there inside. Is it normal? The left one has stopped and okay. I'm a guy.
If you're having any, I don't know if it's a swelling or what. If you say pain, I don't think if it's a pain, you don't need you don't have any problem. But if you say you are having some in your left chest, like around the, is it around the nipple? So if you're having something like swelling wey wan come be like say na seed dey inside, you go hospital so dat dey check it. It might be something that may be removed and then you'll be okay from it. Because one thing you guys should know that men can also have breast cancer. Not be only woman dey get breast cancer. Man fit still get. So if you get any swelling, you notice any swelling for your chest or all that, please go hospital. Go and see a doctor. This time you see a general surgeon and they will look at it and find out if it's something that you should worry about or something where you're not supposed to worry yourself about.
Yes,
Dr.
so
Fred.
okay, this question, why is it that anytime I treat malaria and typhoid, I will be sick and weak seriously? But immediately I stop the treatment, I will be fine again. Oh God, I beg oh. Dr. Israel.
Okay, first thing first is that you only have malaria. There's nothing like malaria and typhoid. Yeah. Okay. Let's assume you even have the two. There are some people, it's your body system. It's your body system. Some persons, and the drug when they take feel react with their body system. That's just part of the side effect. To make them feel weak and tired. Then after they don't stop to dey take the drug, say as they stop the drug, that effect no go dey again. So they come dey strong. So some persons are like that. So it's not, I don't think it's anything bad. Just if you fall sick, go hospital, let them do test for you to be sure that yes, you really have malaria and to be sure that yes, you really have typhoid. Not the one you go and meet one chemist person or one person from one place and he just tell you say you get malaria and typhoid. Please go to the hospital, they will do test for you to be sure of what you really have. So when they don't know what you get, they give you medication for it. Yes, it may make you feel weak, but don't stress yourself. After you have taken the drug, you'll get yourself back.
Okay. If you know say you never share the live session now, share. And then if you want to join my private community, you can subscribe to join my private Telegram. You can subscribe. There is a link for anybody wey wan join my private community. It's on Telegram, but you go subscribe to join. That is why I'm telling you now. So in case you see the post on my page, you go know say na me talk am. So let's continue and take some more questions. The questions are much today. Wetin dey happen? God. Uh can a woman of 50 be ovulating when she is no longer seeing her period? That is menopause. Can she also get pregnant? Hmm.
Okay, a woman that has gotten to menopause, normally, as far you don reach menopause, e mean say everything don pause. Everything don pause. When we say pause, e mean say e don stop. You're not supposed to get pregnant. But science have done a lot. They have done a lot of research. A lot of things have gone into science. So because of the help of science, yes, they can. That woman, they fit still make that woman get belle. But e don reach menopause, so you need to see a doctor. So they will now do other investigation, do some procedure for that person, and the person fit come get belle.
Okay.
So normally on its own e no fit, but science fit help am.
Um, Mudashiru, I have shared. Please talk about eye turning. So when you say eye turning can be caused by so many things. Plenty things can turn your eye. Number one, hunger can turn your eye. Number two, blood problem can turn your eye. Number three, problem with your ear can turn your eye. Number four, eye problem can also turn your eye. Number five, some medication can turn your eye. So if you say you dey get eye turning is not enough. E get many other things wey we go need to check to know why your eye dey turn you. Your eye dey turn you in the morning, in the afternoon, abi in the evening. You dey chop well, you dey feel tired, your ear how e be? E be like you wan fall. So when we don know all these things, we fit come tell you say okay see why your eye dey turn you. See wetin you go do. Try to eat, try to dey monitor your blood pressure, try to dey exercise, this and that and that. But just because say eye dey turn you, it is not a sickness. Na sign of something in your body wey we need to find out. So I go advise you quickly, let eye doctor check your eye so dat make we know why the eye dey turn you quick quick and wetin we go fit do for you. Ehen. Please, can 6 months pregnant still survive with 2 centimeter fibroid outside the uterus? Dr. Israel, please respond.
6 months pregnancy, for you to don reach 6 months pregnancy, e show say the pregnancy can still survive even with the fibroid. Good enough, the fibroid you said is outside the uterus. So if the fibroid is outside the uterus, it does not have any business with your pregnancy. So your pregnancy can still get to 10, can still get to 9 months, and you can still deliver your baby. So it's not for you. Now you can't know. Now you can't know what route of delivering do you want. Do you want to do cesarean section so that they will also use the opportunity to remove the fibroid, or you want to do vaginal delivery? That will be left for you to decide. But yes, 6 months pregnancy can survive even with fibroid.
Okay, so you've gotten the answer, and that's the answer. Oh my God, I have shared twice. Thank you for sharing. Thank you, Jesus. Doctor, please, my wife does not see her period again, and she's still on early 40, but she's 3 month family planning. Now the family planning they cost that one for her now. They're supposed to explain to you before you do family planning for anybody, madam. Before they do family planning for you, you are supposed to understand waiting to expect from that family planning, the side effects, waiting go do your period. They will explain all of them to you. So most likely, waiting your wife the experience might just be from the family planning. But if your wife is still not convinced, make she go back to hospital where dem put the family planning for her and explain to her, because no woman should do family planning until they don explain to you everything about family planning. make you understand what you are putting inside your body. Uh-huh. Okay, the questions plenty, oh. The questions plenty, oh. Mercy. Um, somebody's asking us how to cure ovarian cyst without operation. Dr. Israel, abeg.
Well, that one you go hospital, I don't know.
You go enter hospital, oh. You go enter hospital. You can't. There are different types of ovarian cyst, depending on the type where you get. Yeah. Family planning again. Hey. Who be this? My wife took family planning around month of March and she didn't do menstruation on month of April. And now her menses started showing in this month, May, but not flowing well. Coming out with black and thick 3 weeks now.
Yeah, if you do family planning, be expecting so many different things. Be expecting so many different things. So you don't really need to worry yourself. As Dr. Fred said, you suppose don't get all the explanation about family planning. In fact, nobody chooses family planning for you. You choose the one way you want use by yourself. And they choose them based on informed consent, based on what you know about the family planning. So they're supposed to bring all the different type of family planning for you, explain all of them for you. Then you go come choose the one when you like to choose. Now, another thing you suppose know, family planning affect people in different form. If I use family planning A and another person use family planning A, e no mean say the way wey that family planning A take work for me, e no mean say na so e take work for another person, because our body also different. So because our body different, e go answer to everything we put for our body differently. So if you think say, if you dey worried about how your wife take dey see the blood wey you dey see, or dey see whatever you dey see, you need to make you go see doctor, make dem explain better for am. But for me, I don't think there's any problem. And the stuff will stop, and your wife fit no even see menses again for some months. Just like that. It depends. Some people go dey see am every month. Some person fit just put am and dem no see their menses again until dem remove am. So it depends. Dr. Fred.
Yes, Dr. Israel, one more question. We go on a little break. What are the causes of fast breathing? Ew,
Dr. Fred, answer that one.
fast breathing. If you run, if dog pursue you, you go run, you go pick race, you go breathe fast. If you enter your house, you no know. Suddenly you see snake inside your house, your mind go cut, you go breathe fast. If you enter where dey dusty, where oxygen no dey, you no get enough oxygen, you can breathe fast. If you get problem with your lungs, you can breathe fast. Different lungs problem dey. Even if you get problem with your heart, you can breathe fast. So fast breathing can be caused by plenty things. So ask yourself, this my fast breathing so, when e start? E get anything wey I dey do wey dey bring am, or e just dey come on im own? If e get wetin you dey do wey be say anytime you do dat thing you go dey breathe fast, try stay away from dat thing and see whether you go dey fine. But if whether you stay or you no stay, you are breathing fast every time, fast fast, please see your doctor, make dem check you. Is that okay? Make dem check you. Please, please, because many things can cause fast breathing. Even problem from the blood can still cause fast breathing. Now, one more personal information, my own advert. If you want to buy my course on content creation, if you want to get my course, if you're a content creator, you dey post on social media, and you know say you never learn anything about social media, stop. Go and buy my course quickly so that you will not make wrong move and destroy your page. So if you know say you never buy course on content creation, go and get it now. Buy my course, it go help you. You no go regret and you go thank me later. It is very, very cheap. Yes, na me do am and you go benefit. So go and buy the course now. Okay, we have about 10 minutes more and we are done for today. Good evening. Oh my God. See questions. What should I do as I get sleep apnea? How do you know you have sleep apnea? Who be this? Boss said they. How do you know you have sleep apnea? Who diagnosed you of sleep apnea? Because if any doctor diagnose you of sleep apnea, and then we go find out wetin cause am. Are you obese? Abi you get enlarged tonsils? Depending on wetin dey cause your sleep apnea, we go come tell you, try to lose weight or make we correct wetin dey do your tonsils many many things. But you can't just say you get sleep apnea and then you wan go dey treat yourself. No now. Dr. Israel, any comments?
No,
Okay, no comment. Please, how to cure infection worm? Oh my God, how you take know say you get worm infection? Dr. Israel, abeg over to you.
Dr. Fred, I
Yes.
think not be all question you need to dey read. We still get rules when they guide us. I think before every of our this thing, we will always let them know the rules. Anything when do a when anything when bring about cure, treat, we don't actually talk about it, because if you want to know cure, e mean say you the same way we prescribe drug for you. E mean say you the same way we write something for you or tell you something when you go buy or that. So if you really need to, we are just here to educate you, to give you information, and in some ways still remind you say hospital is the best place to go to get every kind of treatment. So we no go fit treat you for here, um we no go fit treat you for here. It's not our that no be wetin we come here come do, because we still like our license, as Dr. Fred dey always dey talk. So we can't treat you here. So most of the time when you say how can we cure worm, I no understand. What do you want me to tell you? Na im make sometimes I go just say go hospital, because there's no way I want to wetin I wan explain for that one. Dr. Fred.
Yeah, thank you. Thank you. Okay, so we are almost out of time. Um, we're almost out of time. Now, so many people they see us for the first time. And sometimes we know they read, I know they read your questions. And me nobody say, why are they not reading my questions? They ignore me. That is why sometimes I just put it up and we respond to you. But you cannot treat anybody on social media. They don't deceive a lot of you. Tell you that if you get this problem, go and buy this tea. Madam, if you get this fibroid, go and drink fibroid tea. If you get hernia, drink hernia tea. So you think we are like that. We are not mates with those people. Those people, they are insults to us. You understand? So when you come here and asking us to treat you, it's like we don't know what we are doing here. We can't treat you online. Hospital is the best place for you. Our job here is to educate you. If you feel you have infection, don't buy any nonsense medicine, infection flusher online. When you waste your money and then you come to the hospital, you go spend times two. Because number one, that your infection go don tie wrapper, e go don complication. Number three, the medicine wey dem go use, e go even high pass wetin dem suppose to use. So be careful, and that is why we always tell you if you have any problem, go to the hospital. Here na to teach you, not to cure you or treat you. Is that okay? Ehen. Um okay, let's see. Can an SS person breathe fast on a normal even without running or something? So for people wey get sickle cell warriors, sometimes their red blood cell dey go down. Dem dey get anemia, low blood. And when the red blood cell go down, one way wey dem fit take know, wey we fit take know from dem, you go see dem dey breathe fast. So it's possible that SS, when they don get low blood, no be all SS so go breathe fast. But in some cases, when the blood don go down, dem fit come dey breathe fast. Another one too, some of dem fit even get heart problem. Some of dem fit get heart problem. Dat heart problem fit also make dem dey breathe fast. And dis is why you are not suppose to sit down at home and be asking people, abeg, wetin dey do me, wetin I go do? Those people can kpai you because dem no get information concerning human life. So if you notice dis thing, always go to the hospital, make doctor check you and treat you. Good. And this person says, please answer me before you leave. We don't answer you before now. We have answered you, Mr. Sonny. Which question again? Which questions again? Or let me see. I hope I don't miss anyone. Okay, please, what do I need to do to avoid baby tying cord on neck in my next pregnancy? Because it causes IUGR in my last pregnancy. Can it be prevented? Dr. Ezra, want to respond?
There are some things that we cannot prevent. That's just between the baby like the cord, so he decided to hold the cord. Eh? We are sorry that it causes
IUGR.
interuterine death
No,
uh, for
growth
you.
restriction.
We
Growth
are
restriction.
okay. Sorry, interuterine growth restriction. Okay, we are sorry that that happened, but and trying to imagine our cord. Okay, tying cord. Our tying cord around the neck because we lead to that. Okay, let's leave that. But as I said, that's just some. There are some things that cannot be prevented, and you just hope that it does not happen in your next pregnancy. That's just it. Yeah. Not be every pregnancy they happen. Some pregnancy it is even worse than that. Some pregnancy if you tie the baby hand and the hand will cut come out, you no get hand. And so if you tie a neck like that for some, you go kill the baby will you give birth to so you call am stillbirth. You have stillbirth. So just keep your fingers crossed and take your normal folic acid and your normal drug. You know.
Yes. So we have to go now. Our time is almost up. The person says, please answer me before going. We don't dey answer a lot of you now. We don't answer now. Good afternoon. We are evening. Yellow urine color. Is a sign for which sickness?
Yellow urine color. And when your urine dey get color yellow, most of the time it's a sign that you water not too dey your body, like dehydration. Let's just say dehydration. So what you need to do is to take a lot of fluid. So when you take a lot of fluid, that urine go actually come back to form to white. Now the reason why e dey be like that is just that the body dey try to make sure say the amount of fluid wey the body need e still remain normal. Den so any excess na dey go remove, and because dey remove excess, dey remove am with a lot of waste. If the excess is small, the colour of the waste na go come make the urine dey yellow. And but if the excess is small, e go dilute the urine very well and you go fit urinate everything, every waste comot from the body. So for that person, we advise say dey drink a lot of water. Dey drink a lot of water. Dr. Fred.
Okay, thank you so much. One more. We are almost out of time. Good evening, doc. Please, is hepatitis C virus curable? Yes, it is curable. It is curable. Yes, it is curable. After a year of giving birth and not yet seen my menses. Dr. Ezra, you want to respond? She don't born and 1 year she never
After a
seen
year
it.
of giving birth, if you never see your menses, the first thing are you breastfeeding? Because some people, if they dey breastfeed, until they stop breastfeeding, they no some of them no go see their menses. Yeah, so na normal thing. Now, two things can happen. One, either you na breastfeeding, lactating family planning, which is like a natural family form of family planning, because you dey lactate, because you dey breastfeed, is stop your menses. Two, e fit be say you don collect another pregnancy. So you need to check to find out if you never collect another pregnancy, and if na breastfeeding, you know say na the breastfeeding dey cause am. Den if e be sey your age don dey reach, e don reach dat menopausal age within 45 to 55, and e come be sey as you born you don see your menses, e fit just still be sey you don enter menopause.
Okay. So if you are still breastfeeding, your breastfeeding is most likely the reason why you dey they see your period. So no need to panic. As far as say the breastfeed, some women their breastfeeding can affect them like that. Period no go come for a long while. So that is it. That might just be your own reason. Dr. Israel, any final words as we round up?
Okay, my final words is virtue Sonny. Yeah, I saw your question, and the answer is yes. E go fit still impregnate, e fit still give you belle, e fit still make you become a mother. So no fear, no fear. Eh? Except maybe you get other reason why you dey vex, not be because of that. So but no fear, e go fit give you belle as far e dey come, uh, as far e dey release from inside, and there's no other problem. So my final word is also continue telling you everybody thank you when they join us every Sunday by 8 p.m. to listen to us. Yes, we know say sometimes we cannot answer every questions, not by our fault. And it's also depend on the time when you take come, and sometimes network can actually delay some person's questions. And also it depend on how your question still be, if it's not fully clear to us, and if it's carrying some element of say when we give you medication or talk one or two medication, those fit still be the reason why we no answer some question. For all the same, we want to say a very big thank you for joining us every Sunday. We no dey take you play, we don joke with you. As you dey use your data, we say thank you. Dr. Fred, thank you so much for always making this 8 p.m. to 9 p.m. work for us.
Yeah, thank you so much, Dr. Israel. Thank you. I really appreciate you coming, and you will watch us. Thank you for spending your data here. I beg, if you get any medical problem, go to the hospital, see your doctor, may them check you and may them help you. And be careful with I hear say, I hear say, I hear say, I hear say, I hear say. We don't even want may you come follow us. We are not looking for you to consult. No. Go hospital, eh? May them check you so that make them no use your own body chop you on the internet. I always say, good life now waiting. Good life. Na sense. If you never subscribe, if you never follow, click on the follow button. We go see you next week, Sunday, same time, 8 p.m. to 9 p.m. on this same place. Bye bye.